people are indicted in his death. Well, there are so many things pregnant moms can worry about when it comes to their developing baby. Their tiny hearts bring a threat for the most common birth defect. As we wrap up Heart Month, Amanda Fay learns how problems are found months before birth.
The Yoakums spend a lot of time with ProMedica pediatric cardiologist Claudeen Whitfield. 19-month-old Rory was born with a congenital heart defect, something mom Lacey learned about at her 20-week ultrasound.
Let's just listen. We thought we were going to go find out if he was a boy or girl, but we ended up finding out a little bit more, thankfully. If we didn't find out, Rory wouldn't be with us today.
Let's try that.
Basically, Rory's pulmonary valve never formed while Lacey was pregnant. That kept blood from flowing into his right ventricle, which then pumps blood to the lungs. But it turns out Rory was lucky. Hours after he was born, doctors were already working on his heart.
The right side of his heart was growing, so he was a perfect candidate for what we call radiofrequency ablation, and he's done extremely well.
With a laser, a hole was burned through that blocked valve to get the blood flowing.
It's okay. Oh, it's okay. Oh, he's not having it.
Dr. Whitfield says many children with congenital heart disease go under several open heart surgeries before their first birthday. And it turns out CHD is fairly common, 8 in 1,000 live births. Luckily, there have been advancements in treatment.
Most children who have congenital heart disease go on to live a very productive and normal adulthood life.
Lacey says it took a while for the shock of the news about her son's heart defect to wear off, but she's embraced it and is now doing something to help other families as vice president of the Pediatric Congenital Heart Association for Ohio.
And that's okay to be scared, it's okay to cry, it's okay to grieve, but there is support, and there are others out there locally and nationally that have gone through something similar, and we're here to help.
There's no cure for congenital heart disease, and someday Rory will need a new pulmonary valve. Dr. Whitfield says it's still not clear what causes the common defect, but wants moms to know this.
It's not your fault, right? There's nothing you could have done to prevent this. It's not what you had to eat the day before or anything.
For links to support groups and local services, check out this story on our app and website. For WTOL 11, I'm Amanda Fay.
A local group giving a big boost to the diesel technology program at Owens Community College. Silky